Well, thank you, everybody. Thank you for having me here today. As Ahmed mentioned, I'm a senior program officer here at the National Academies of Sciences, Engineering, and Medicine. And that means I direct the consensus reports that David mentioned, and I'm going to go through a couple of them today that specifically focus on science literacy, health literacy, and science communication. Just to review, as David said, we are 3 honorific academies as well as an operating arm that advises the nation on science, health, and medicine, something we've been doing since the 1860s. And I'd just like to reiterate what David said, that all of our advice is provided by volunteers. We do not have a line item budget from the government. We are commissioned to do work on relevant science topics, and we enlist the nation's experts to help us make that possible. So in the last few years, we've been asked to look into 3 topics that are very relevant to us today. In 2016, we put out a report on science literacy, that is what it is and how it's relevant to the public support of science. The report noted that science literacy includes understanding scientific concepts and practices, such as the forming and testing of a hypothesis, the relationship between probability and risk, and the difference between causation and correlation, something that probably most of us in this room understand, but that can be very hard to communicate to a lay audience or someone who doesn't have high science literacy exposure. Science also includes knowledge, obviously, about a science or a field of science, including basic facts, concepts, and relevant vocabulary, and it includes the understanding that science is a process, a social process. So not just an experiment, but that it involves criteria by which someone is identified as an expert, the process of peer review that David mentioned to make sure that the scientific findings are valid, and disclosures about sources of funding and conflicts of interest. And knowing these things about science literacy helps individuals, when they want to use science in their lives, interact with science information and make decisions that are based on science. Science literacy is tested or understood largely with surveys, public opinion surveys that are distributed, and there are a number that have been distributed not only in the US but around the world. And from those surveys, we know that the knowledge of US adults on science is comparable to that of other developed economies. But what we also know is that while there's a small positive relationship between general knowledge and attitude to science, when you go down to the next level to specific scientific issues, that general scientific knowledge doesn't necessarily translate into support of specific scientific issues. That people's knowledge is affected by their religiosity, their political dispositions, their worldviews, and their deference to scientific authority. And so when there are controversial issues in science, just because you have a greater knowledge of the topic doesn't mean that you'll agree more. It can actually lead to increased polarization. And people will often tend to seek, as we see in the political sphere, we also see in the science sphere, that people often seek information that's consistent with their views, or they avoid information that would be inconsistent with what they already think. And the report, lastly, the report noted that while we know a great deal about individual scientific literacy, there's also a lot to learn about community and societal literacy. When it comes to societies, the evidence is rather dismal. People have difficulty with scientific literacy because they have a difficulty with foundational literacy. That is just the ability to process oral, written, and graphic information and to be able to apply that information to further learning. And while the committee that conducted this report couldn't find examples of that that's specifically related to scientific literacy, it makes sense that if you have a basic challenge in reading, period, then you're going to have even more of a challenge with accessing scientific information. When it comes to community scientific literacy, it found that communities are able to work in concert to contribute to the overall well-being through sufficient shared capacity to address a scientific issue, and that they can in turn collect information and share that knowledge with scientists. There is case-based evidence to show that community involvement has helped to bring new questions to light, provide data that would otherwise be unavailable to scientific problems, and produce new instruments and technologies. And I only know this anecdotally. I don't know that this was, I think this report was before this, but I think we saw some of that happen in the Flint water incident in Michigan, where the community banded together, tested their water, and applied that learning to the problem. So overall, the report concluded that although there's a positive relationship between literacy and attitudes that support science, that doesn't mean that support for science in general will translate into increased scientific literacy. It doesn't always also predict that an individual will have an individual that's science literate. That doesn't predict necessarily what they will think about a specific science topic. And some topics, such as genetic engineering or vaccines, two topics we frequently address here at the National Academies, can be so connected to people's individual worldviews or religiosity or what they think about the nature of science in general, that just because they support science doesn't mean they will necessarily endorse a specific scientific finding about a particular topic. Therefore, it's likely that efforts to simply promote more knowledge about science are unlikely to influence how people think about science. And therefore, efforts should focus on not only increasing knowledge, but also in removing impediments to action and lowering the literacy demand in particular situations. Future research on science literacy should focus on what kind of conditions are needed and what type of knowledge is needed to be acquired to affect individual attitudes and behaviors related to science. I should have mentioned at the National Academies, all of our reports, we definitely have like, what more research is needed? There would rarely be a National Academy report if we didn't identify what else we need to know. To what extent do the measures of scientific literacy map to people's ability to accomplish specific tasks, such as understanding science and health messages, choosing between competing sources of information, or identifying expertise or modifying their behavior? And how can we measure, understand, and support the feature, structures, and circumstances of communities that make it possible for them to engage collectively and use science? So turning to health literacy, in 2004, so much earlier than the previous report I just talked about, the National Academies released this landmark report. At the time, it was underappreciated that nearly half of US adults struggled with health literacy. That is, when they encountered the healthcare system, millions of patients were not able to comprehend their condition and treatment, to make the best decisions for their care, or to take the right medications at the right time in the intended dose. So this report really shined a spotlight on that problem and helped create a wide range of tools and practices to help organizations from large healthcare systems to individual care providers to engage with health literate discussions and provide health literate material to patients and family members. And the National Academies has continued that work in the last decade and a half through the Roundtable on Health Literacy, which is a body of experts that hold workshops, several workshops a year, that inform, inspire, and activate a wide range of stakeholders to support the development, implementation, and sharing of evidence-based health literacy practices. And they do this on a number of topics. So they've looked at how can you better communicate to patients the correct dosage of medication to take. They've also looked at the difficulty of navigating the healthcare system, particularly when so many people came into the healthcare system after the Affordable Care Act was passed who might not have encountered regular health care before. How can we better communicate to that population? They've looked into specific conditions. This workshop report on people suffering from cancer was just published, and it also, not only does it look at how we can communicate better with people who are battling cancer, but also how can we communicate better so that people never get cancer in the first place? What preventative measures can they take? Also, people dealing with behavioral and mental health issues often have an extreme challenge when it comes to communicating health literate messages to them. And then palliative care, people at the end of life decisions or people who are in pain, what is the best way to communicate messages to them? There's also many different types of populations in the US, of course, the older population being one of the fastest growing. And we also know that older populations are also highly correlated with low health literacy. So how do we communicate to this population? The United States is becoming increasingly diverse and in terms of ethnicity as well as culturally. How do we bring all of these populations into the healthcare system and make sure they're getting the appropriate care and they're understanding it? And people with disabilities are also extremely vulnerable in the health system. How do we make sure that they are receiving the information that they need? As I mentioned with the science literacy, community-based health literacy is also very important. So the community has the roundtable has also taken a look at what we know about community-based health literacy interventions, and then they've also kind of taken a step back and said, okay, following the 2004 report, a decade or so on, what do we know about health literacy, both for the individual and for larger communities, and why is it so important? Like, let's reiterate this. Two reports I didn't mention, one that's about to come out, and then a workshop that's being held in the future. We also held a workshop in November about communicating to youth, who are, of course, getting a lot of their information online, who may or may not be consulting with adults when they're consuming health information, and so what kind of information do younger people need to make good decisions about their own health? And then coming up in May, the roundtable will be holding a workshop on health misinformation, so it's very timely. Along the same vein, we had a committee that worked on how to effectively communicate science to the population, and I think nobody in this room would be surprised that that's an extreme challenge, because science is not always certain, and as I mentioned with the first report, it's a process. So getting people to understand that process and then communicating a message that's consistent and not misinterpreted is a challenge. So one thing that the committee identified, they identified a couple cross-cutting issues, and one is aligning communication approaches with goals. Not every audience is the same, and so not every communication strategy should be the same. And what can we learn as a scientific communication endeavor about how we communicate to those different audiences? Also, they just put a nail in the coffin of the deficit model, as I mentioned earlier. Giving people more information is not necessarily going to make them agree with what you said because of all the motivating reasons that I listed earlier. And then there are a number of challenges to study, because science communication as a research field of study is still evolving. So we need to understand that intersection between like what individuals think and what society brings to bear in them, and then how messages about science are understood. We need to rethink how we communicate with policymakers. I think we all know that a policymaker can have, just like any individual, they can have the best science available, and that doesn't necessarily drive the decisions they make. So how do we get scientific messages, just not across to policymakers, but actually have it influence the decisions that they go forward with? Engaging formally with the public about science. What are the best structures for public engagement to make sure that we communicate effectively? And what approaches can be generalized and what approaches need to be tailored to specific audiences? As always, when science is involved in a controversy, people bring their emotions, they bring their previous knowledge, they bring their worldviews to that issue. And how can we engage the public in a way that allows us to get to some sort of consensus? David mentioned the consensus process that we go through on the committee to get to a resolution. We have obviously not found a great way of doing this as a society, and what can we learn about how to improve upon that when we talk about science controversies as a culture and a nation. Obviously, the media landscape has proliferated a great deal in the last decade or so, and so we're not just communicating through print and 3 major networks. We're communicating through onslaught of cable options as well as online options. And so how do we keep a message that's consistent, easily understood, and accessible across all that media? And then we need to, as with all endeavors to learn, we need to assess what we've learned from these scientific experiments on communication, and then feed that back in so we can learn more. So as scientists, of course, the report called for randomized controlled field experiments to assess impact, which may have been difficult to do in one time, but now, of course, with the feedback of all our online systems, perhaps this is something that would be more easily achievable in putting out a message and getting easy feedback and quick feedback. And that would also apply to research that simulates real-world communication environments. And then analyzing the data sets that we have on how people interact with science messages and how we can use that information to improve communication. So I'd just like to say that we at the Academies have tried to take some lessons from our own reports and have recently launched a small project on communicating directly to a lay audience about science and health questions. This is our Based on Science website. We've tackled a couple of problems, just a small number of problems that are commonly asked on the web, and often have specious information associated with them, and which we can draw on our body of expertise to answer. And these aren't always the kind of questions that our sponsors come to us to answer. These are the kind of questions that people type into Google at 11 o'clock at night. And so we have a few articles about fluoridated water. Of course, vaccines seems to be a perennial issue, unfortunately. Miracle cures for cancer. You know, people are in pain and they're looking for answers, and they're looking for solutions that might either be less painful or less cost prohibitive. But a lot of those solutions that are offered are obviously ineffective and are actually being proposed by somebody who's trying to profit off someone's pain. And so can we just provide one more data point of information to people that this is not credible? And then, of course, climate change. We have a great deal of, a number of reports on climate change. As David mentioned, there's a Wikipedia edit-a-thon going on with a focus on climate today. But our reports are long, dense, and thorough, and how can we distill that information into a way that people can access quickly and find online through search easily? This is just an example of one of our articles that's very, very short, and so it's easy to fit on a slide, just debunking that sunscreen will not make you vitamin D deficient. It's very important to use, and does prevent skin cancer. And so that's something we hope to expand. This is the type of program we hope to expand upon in the future to make a little bit more content readily available to a broader audience. So again, thank you for having me, and I look forward to the rest of the presentations this morning.